بسم الله الرحمن الرحيم والصلاة على محمد وآل محمد. محاضراتنا اليوم عن السي في اي، هي عدة محاضرات عن السي في اي. راح نعتبرها انه تجيك هذه لونج كيس شورت كيس زين، وشنو الاسئلة المهمة على السي في اي كلها جمعناها حتى تنتبه لها وتجاوب على كل شيء. الهيستوري هذه لونج كيس 65-year-old male suddenly collapsed, unable to talk, unable to stand. He got dense right side hemiplegia. He is right-handed. He got severe hypertension on no treatment for the last 2 years, and he got diabetes too, on diet only for the last 10 years. He is heavy smoker, 60 cigarettes per day for more than 50 years. He is obese. BMI of the patient is more than 40. On examination, he is conscious, nasogastric tube in his nose, where he is dysarthric, catheter in his bladder, unable to move the right side of the body, mainly the right arm. Where he gave a history of acute MI 2 years ago. He also gave a history of a sudden right side weakness 1 year ago, completely recover after a few hours. That is transient ischemic attacks. He have a positive family history of ischemic heart disease, of CVA, of hypertension and diabetes. His blood pressure 190/115, where ECG he got old inferior MI, carotid bruit on the right side, on the left side, sorry, there is a bruit on this area, carotid bruit. We use the diaphragm and we ask the patient to stop breathing. You will hear carotid bruit on the right, on the left side, and completely left side of the left side, and completely paralyzed, flaccid paralysis, acute paralysis of the right side of the body. What is questions? What type of CVA in this patient? This patient, because it is suddenly happened, acute happened, where his blood pressure is high, and a sudden onset symptom were high systolic pressure. Therefore, this is most probably bleeding. Bleeding because of what we said. But this patient could have embolization from the carotid. We hear bruit there. It means there is a thrombus there, nearly occluding the carotid artery, and embolization from that thrombus, from the carotid artery, and because of the positive bruit. Unlikely to be thrombosis. Usually thrombosis is coming slowly, during sleep, elderly, debilitating. Question 2, define CVA. How you define CVA? CVA is a neurological deficit of cerebral vascular cause that persists beyond 24 hours, or that leading to death within before 24 hours. اما الكتله خلال 24 ساعه السي في اي، او السي في اي تبقى وراء 24 ساعه. This is هذا تعريف السي في اي. What is the causes of his weakness in the right side? In the right side 1 year ago, it is a transient ischemic attack that because it disappeared within the first 24 hours. Question 4, stroke is a major cause of death in USA. Yes, true. Major cause. The first cause of death in United States is CVA. CVA, it killed 150,000 per year. It killed them. And in USA, this is in USA. In USA, there are 3 million people with crippled from CVA. 3 million crippled. USA spend, the cost of expenditure on the CVA is more than $45 billion. 2/3 of CVA happen in people after 40. It is false, actually. It is 2/3 of CVA happen after 65-year-old and more than 65-year age. So question 9, CVA in male is more than the female. Yes, number of CVA in male is more than female, true. CVA death is more in female than male. Yes, true. Surprisingly, أنه 60% of death due to CVA are female and 40% of death due to CVA are male, because probably they live longer time and probably tolerating more than the male. A black American have more CVA than white and more death than white. True. Question 12. Transient ischemic attack is better diagnosed by CT scan. No, it is not. It is better diagnosed by MRI. Causes of CVA. True causes of CVA. 80% of CVA due to thrombosis. 20% due to hemorrhage. And of that 15% they do get hemorrhage inside the brain, and 5% they do get subarachnoid hemorrhage. Causes, probably they ask you about the causes of ischemic CVA. Ischemic CVA, thrombosis and embolization. Embolization in CVA, it is either from the carotid or from the heart when the patient got atrial fibrillation. Causes of transient ischemic attack. Transient ischemic attack here, it is the closure of small arteries affecting small brain area, brain tissue, and sign symptoms disappear within 24 hours. Why MRI in transient ischemic attack is better than CT scan? They had observed that most of the transient ischemic attack disappear within the first hour. Most of them disappear within first hour of happening, and some of them, few of them, disappear after a few hours, 2 to 3 hours. Therefore, and some of them it will stay more than 2 hours. Therefore, MRI is better than CT scan. Question 17. This patient is mostly due to embolic causes. Why it is embolic? Because an emergency condition, acute condition, the patient got atrial fibrillation due to clot detached from the carotid artery, or and move to the brain, causes embolic CVA. And probably it is due to hemorrhage. The hemorrhage because it's also acute, high blood pressure, diastolic pressure more than 70, and this is make it unlikely thrombosis. Causes of hemorrhagic CVA. Real causes of hemorrhage. Why they do get hemorrhage in the brain? Because of the weakness of the artery wall, or the patient got AV malformation, or he got a rupture aneurysm. And as we said, CVA are two types. Bleeding are two types. Intracranial, it is 15% of hemorrhage is intracranial, and 5% of hemorrhage is due to subarachnoid hemorrhage. What are the drugs that predispose to hemorrhagic CVA? Cocaine, drug addict, amphetamine, alcohol, antiplatelet, antithrombotic, warfarin, heparin, DOAC, all these predisposed to hemorrhagic CVA. Question 20, CVA, all CVA is life-threatening. No, it actually no, because transient ischemic attack is not life-threatening. Therefore, most of the CVA life-threatening, yes, true. Severe CVA causing coma, yes, true, can cause coma. If coma happen in CVA, it's bad prognosis. What are the things that predispose to CVA? Things predisposed to severe hypertension, especially severe hypertension, diabetes, smoking, obesity, hyperlipidemia, atrial fibrillation, advanced age, pulse pressure more than 70, all these predisposed to CVA. Drug, as we mentioned, cocaine, amphetamine, alcohol, antiplatelet, antithrombotic, warfarin, heparin, DOAC, all these predisposed to CVA. What are the differential diagnoses of CVA? Differential diagnoses are four actually: subdural hematoma, cerebral tumor, membranous hemiplegia, hypoglycemia. All these differential diagnoses, you must exclude them. Subdural hematoma, typical patient who is alcoholic and the history of a trauma or fall on his head, sign symptom fluctuating, and the headache is severe but not fixed. While tumor at the gradual onset, slowly, headache is constant, with conscious level decreasing gradually. While migraine is a young female, visual aura she got vomiting, headache, membranous headache, no evidence of AV malformation, CSF يكون negative, angio is contraindicated in migraine. Angio is contraindicated in migraine. Hypoglycemia, typical patient or diabetic patient on insulin or on a drug that reducing, increasing the secretion of insulin. The patient is pallor, sweaty, and pupil is dilated, not constricted, where sign symptom relief by giving dextrose intravenously or glucose intravenously. A brain not need insulin to take glucose from the blood. Brain, it took glucose from blood right away. A brain damage occur if you not treat the hypoglycemia after 2 hours. You should treat hypoglycemia before 2 hours of that CVA, of that hypoglycemia. Brain damage occur if not treated after 2 hours. A brain can use glucose for his energy and can use ketone body for it work, and both of them they took it from the blood without aid of insulin. A ketone it need a lot of hours to be form in large amount. Therefore, the brain in the first 2 hours ketone are not small amount. Therefore, we do get brain damage from hypoglycemia if you not treat. And in cerebral tumor, we forget to say that papilledema can occur in a cerebral tumor. Therefore, ketone is not enough to give energy to the brain and avoid damage. Therefore, hypoglycemia need urgent treatment. Thank you very much.